thanks for tuning in. My name is Leslie and I'm a sports physiotherapist. Today we'll be talking about one of the most common upper limb injuries for racket sports, and that's simple tennis elbow and golfer's elbow. So we have a model here, and what we're going to demonstrate first is tennis elbow. Now, tennis elbow is basically inflammation of the muscle tendons, okay? And these muscle tendons control the movements in the wrist and the fingers, okay? And they all join into this little area here called the common extensor origin, okay? Now we call it CEO for short, okay? Not Chief Executive Officer, but the common extensor origin. So you can see these tendons join into the bone itself, and they all join in a very, very small area, about 1 to 2 centimeters square. Okay, so some people with a lot of racket sports, from tennis, golf, badminton, okay, they often do get this thing called tennis elbow. Now on the opposite side of the elbow, okay, on the inside of the elbow, there's a very similar problem. Okay, now this one's called golfer's elbow. Now it doesn't mean that only golfers get it. Sometimes tennis players get golfer's elbow. Sometimes golfers get tennis elbow. Okay, it's just a name that they've given it to this injury. So for golfer's elbow, similar to tennis elbow, all the tendons that control the wrist and fingers, okay, they run all the way up along the arm, and again they all join into a very, very small area, okay, called the common flexor origin, or the CFO. Okay, so we're going to be talking about strategies and exercises to deal with both tennis elbow and golfer's elbow. Now with these injuries, what commonly happens is tightening or shortening of these muscles along the forearm and wrist. So the first thing we're going to do is a simple stretch. So our model Mara will demonstrate the stretch for tennis elbow. So as you can see, she's pulling down, okay, and you should feel a stretch all the way up into the hand. Now if you don't, you can make it a little bit harder. Keep the elbow steady, so don't let it turn in or out. So keep it stabilized, and the hand, or the wrist, actually turns outwards, and you should get a really strong stretch all the way up, okay, into the common extensor origin. So that's a basic stretch for tennis elbow. On the other side, golfer's elbow, very simple. Once again, just pulling back, and you should feel the stretch all the way up, okay, into the actual common flexor origin itself. Alright, so that's the simple, those are the stretches for these injuries. The next step is, okay, to do what we call deep frictions. Okay, now all you need is some cream or massage oil. Now you can notice, if you notice, these tendons, they run down along the arm, okay? So you can do this yourself, or if you don't have the strength, maybe get someone to give you a hand. And all you want to do is put your thumb right on the tendon itself. Now, if you go a bit higher, you'll feel the bone, okay? Very, very hard. Just go a little bit lower, just off the bone. And what we're trying to do is stimulate blood flow to the area, okay? So stimulate the recovery. So get your thumb and just press in there, okay? And just rub across the tendon, okay? So perpendicular to the tendon itself. Alright, so almost as though you're like strumming a guitar string, okay? So up and down, change position, up and down, okay? So very easy, and you can go further down into the arm as well. Okay, so you can do this yourself, right? And it's meant to hurt, alright? So unfortunately, these injuries, okay, with these tendons in this area, there's a very poor blood supply. So often when people get tennis elbow or golfer's elbow, they're surprised to find that it still hurts maybe 1 month or 2 months down the track, simply because the recovery process and the healing process is so slow. Alright, but this stimulates it, okay? So it gets it going faster. Alright, so we're gonna flip over to the other side. Same thing with this. Get someone to help you, okay? Now use your fingers or your thumb, okay? Whichever you can. And same thing, you're rubbing across the tendon, okay? So up and down across. Try not to press directly on the bone, okay? Because you can inflame it, make it a little bit worse, okay? So it's off the bone, on the actual muscle or tendon itself. Alright? So that's called cross frictions, okay? For golfers and tennis elbow. Very, very effective. Okay, now after you rub it, it's a good idea to put an ice pack on it, alright, just to settle it down. And in fact, that goes with all the injuries we've talked about, from runner's knee, runner's knee, jumper's knee, okay? It's good to ice the actual joint itself, especially after sports, and in fact, it does help prolong your career, okay? So, now, the next thing we're going to go to is how to strengthen these tendons. So the next step is actually strengthen these tendons itself. Now, one of the most effective strategies is to use a resistance band such as this. We call it a TheraBand, okay? So all you need to do is find a table or a high table or a bench like this, and the arm will be in this position. Now the arm should be what they call a functional position. So when you think about hitting the tennis ball, okay, usually your arm is almost straight, but just slightly flexed, about 10 to 20 degrees. So try and train your elbow or the forearms in the same position that you would, okay, when you're playing your sports. Okay, so very simple, just with the forearm anchored, use the TheraBand, okay, and all you do is just step on it, okay, just step on it, take up the slack, and our model here is going to basically lift the arm up, just like that, okay, and she's going to go up and down like this. Okay, very simple. Now all these exercises, once again, just like the other exercises for the knee, okay, has to be pain-free, okay. So if you do get pain, you have two strategies to help this. The first one is just hold it still, okay. You don't have to move it up and down, just hold it there, okay. Now if that's still painful, then just take the slack off a bit. So okay, so I'm going to kind of just lift it up, okay. So it's a little bit less tension now on the TheraBand, and just hold it there, okay. So that's the simple exercise for tennis elbow, okay, which is the top of the forearm. For the golfer's elbow, just going to flip it over. Right, same thing, so go up and down, nice and easy, okay? So once again, no pain. If you do feel pain, okay, just hold it still, alright? Hold it still in a static position, maybe 20-30 seconds, okay? For the dynamic movements up and down, this is really a low intensity, higher rep exercise. So you should be looking to do about 20 or 30 reps, okay? 3 sets. Now if you do have pain and you want to continue playing, there are some devices you can use to help. And one of the most common visual devices that you've seen around is the tennis elbow strap. And our preferred choice is Breg, and this works on both golfers and tennis elbow, and it helps by basically bracing the muscle, okay, as you use your forearm and your elbow, okay. So it takes the load off the common extensor origin and the common flexor origin, okay, very effective. The other thing as well that really helps, studies have shown is that by using a new grip on your racket, okay, because it's a new grip and you won't have to grip it so hard, that can actually help, okay, with reducing the pain in your elbow. Plus, by using a new grip and making it a bit thicker, okay, a thicker handle grip often requires you to grip the racket not as tight, okay. So again, that can help decrease the load through your forearm and elbow. Okay, so those are some simple tips for staying fit and healthy with your racket sports, and good luck on the court.